Hi everyone, Dr. Bruce here. In this video, we're going to take a look at the ascending and descending spinal tracts in the spinal cord. So let's begin with the ascending spinal tracts. Remember, ascending tracts are all sensory tracts. Sensory information goes into the central nervous system, motor information comes out. So ascending tracts are all sensory. We're going to begin with what's called the posterior column or dorsal column pathway. So just to review a little bit of the anatomy of the spinal cord, this is a transverse section. We have the gray matter on the inside, the white matter on the outside. The white matter, remember, is myelinated, so it's faster than the gray matter, and that's where the tracts are. So the white matter is divided up into sections called funiculi. So we have the anterior funiculus, lateral funiculus, posterior funiculus. The dorsal column pathway or posterior column pathway, these tracts are located in the posterior funiculus. So there are two of them. They're called the Fasciculus Cunatus and Fasciculus gracilis. And the key information here is the cord level, T6, the sixth thoracic level. They really occupy the same space, but if it's above T6, it's called Fasciculus Cunatus. If it's below T6, it's called Fasciculus gracilis. So these tracts carry sensory information such as discriminative touch, visceral pain, vibration, and proprioception. So what is discriminative touch? It's the ability to discriminate between one versus multiple touches. So say you have two pencils and you hold them close together and you touch someone on the back, and then you ask them, do you feel one or two touches? Well, if they're close together, they're probably going to feel one touch. If you start moving them apart, eventually they're going to feel two touches. That's discriminative touch, the ability to tell one versus 2 points of touch. Visceral pain, of course, is your organ pain, like your heart attack pain, gallbladder pain, bladder pain, and kidney pain, and so on. Vibration is vibration. Proprioception is joint position in space. So these tracts are going to carry all of that information. So if there's damage to these tracts, you're going to get loss of unilateral sensory information, this information below the lesion. So those are the dorsal column pathway tracts. Let's look at the spinal thalamic tracts. These are very important clinical tracts, and they work together. There are two of them that work together. There's the anterior and the lateral. These cross at a couple of levels above where they exit the spinal cord. The anterior, located in the anterior funiculus, carries light touch and pain. The lateral, kind of a classical clinical tract, located in the lateral funiculus, carries pain and temperature. Damage to these tracts results in sensory loss on the same side below the level of the lesion, so it's unilateral. Let's look at the anterior and posterior spinal cerebellars. These are both located in the lateral funiculus and carry information that the cerebellum processes, such as coordination, balance, proprioception, and fine motor movements. The anterior pretty much focuses on the information from the lower portion of the body below L3 and crosses near the cerebellum. The posterior focuses on the upper portion of the body above L3, and the fibers remain on the same side. So those are some ascending spinal tracts. Let's look at some descending or motor tracts. We're going to begin with the corticospinal tracts. So they pretty much tell you where they go. They go from the cortex to the spinal cord, so you know they're descending. There are two basic categories of these descending tracts. There are the pyramidal and the extrapyramidal. Pyramidal originate in the motor cortex, and they carry primarily voluntary information. Extrapyramidal originate primarily in the brainstem. They carry involuntary information. So let's go back to the cortical spinal, called the pyramidal tracts. There are two, the lateral and the anterior. The lateral, the fibers cross in the brainstem, particularly in the medulla oblongata. The anterior, the fibers do not cross. The lateral carries motor information for distal voluntary movement, skeletal muscles and reflexes. The anterior tends to focus on more of the axial portion of the body, and again carries motor information. Moving on to some of the extrapyramidal tracts, we have the Rubra Spinal. These originate in the brainstem. The fibers cross near the origin. The rubrospinals are going to carry information, again, motor information for muscle tone, reflexes, and posture. The vestibulospinal and reticulospinal tracts are also extrapyramidal tracts. The fibers cross near the origin and they carry unconscious or involuntary information for balance and posture. The tectospinal, another extrapyramidal tract, is a little bit different. That one's going to carry postural movements of the head in response to auditory or visual stimuli. All right, well, that will wrap it up for spinal tracts. Thanks for watching and see you next time.